Male reproductive system anatomy. So as we go through, you'll see that there's a lot of homologous structures that are similar to female structures. I'm going to reinforce it as we go through. All right, so let's start with the scrotum and the function of the scrotum, and then we'll look at like sort of the development of the scrotum. So you can look at it from a few different views. Here's the scrotum here, right? And it actually sort of contains the testes. Here's the scrotum here as well. The function of the scrotum is to protect the testes and regulate testicular temperature by raising and lowering the testes because, strangely enough, spermatogenesis does not occur at normal body temperatures. The testes actually have to be slightly cooler than body temperatures in order for spermatogenesis to occur. So if a testis does not descend through the inguinal canal into the scrotum, in all likelihood that testis, if it's still up in the abdominopelvic cavity, will not do spermatogenesis. So the testes will drop into the scrotum from the abdominopelvic cavity during development, usually around 7 months. Sometimes little baby boys are born and they haven't dropped yet. Remember that before we go any further, the scrotum is homologous to the labia majora in the female. Let's talk a little bit about the functionality or structure first. The middle septum, there is a middle portion right here that actually divides the testes one from the other, and it's called the raphe or the middle septum. And then the testes actually have two different kinds of muscle. Just deep to the skin of the scrotum is what we call the dartos muscle. And stop doing that. And the dartos muscle, just deep to the skin of the scrotum, is smooth muscle, and it wrinkles and tightens scrotal skin. And it allows them to raise and lower just slightly, but not anything dramatic. The muscle that actually can really raise and lower the testes more dramatically is this muscle right here, which is skeletal muscle. It's deeper than the smooth muscle. And it is actually an extension of the internal oblique muscles, and it raises, upon contraction, it will raise the testes closer to the body. For instance, if the person was cold, it would raise the testes closer to the body. It also does it in response to threat. It's not controlled by the sympathetic nervous system, but it might work at the same time as the sympathetic nervous system did. Okay, so now let's go to the testes, right, which are the male version of the gonads. Let's look at those. Okay, so since they are the male gonads, they do the same thing as the female gonads. They produce the gametes, which in males is sperm or spermatozoa, and they also produce the hormones, which specifically is testosterone and other classes of hormones like testosterone called androgens. Okay, so let's look at the internal anatomy of the testes. Okay, so the gross anatomy internal of the testes. So first off, so the testes started out in the abdominopelvic cavity, and then they pulled out of the abdominopelvic cavity, so they end up bringing a serous membrane with them. And so they actually have a double-layered serous membrane that's shown in pink here. So I've got the parietal layer, yeah, and then folded up around, and I've got the visceral layer. The whole serous membrane, it's really an outgrowth of the peritoneum. It's got visceral and parietal layers and a little fluid-filled cavity between it. The whole thing, the pink that you're seeing here, is called the tunica vaginalis, not because it has anything to do with the vagina, but because vaginate means folded, so it's like an infolding. It's a serous membrane. And then deep to that, we run into the tunica albuginea, which we had in the ovaries too, but it was thinner in the ovaries. It's thicker and more protective in the testes because the testes are external and they actually do need more protection. It's a tough, fibrous capsule. It surrounds the outside and also extends into the inside of the testes to divide them into what we call little lobules. So kind of like orange segments, okay? Each individual little lobule has a really curved tube inside of it, And that curved tube is called a seminiferous tubule. It's really, really, really highly curved. So you've got about 250 lobules per testis. Each testis has up to 4 seminiferous tubules inside of it. Come back to the seminiferous tubule and talk about its function in just a minute. And then, before we get into the function of the seminiferous tubule, let me tell you that, so sperm is going to be made here, and then I need to get them out of the testes. I get them out of the testes through these guys right here, which are called, this is called the rete testis. The rete means net, okay? So we go seminiferous tubule where the sperm is made, then the rete testis, and then these little guys right here are called the efferent ductules. Efferent because they're going away, and ductule is a little duct. And then from the efferent ductules, you'll go into this structure, which is the epididymis. And I'm going to come back and pick up the epididymis in just a second. So spermatogenesis occurs here in the seminiferous tubules, and then it's going to make its way out through here. Okay, so what else is in here? So the testes have 2 functions. They make sperm, which occurs in the seminiferous tubules. And if you do a cross-section and look at a single seminiferous tubules, there are also cells that are between the tubules. And these cells are called interstitial cells or Leydig cells. And these are the cells that make testosterone and other androgens. So sperm comes from the tube. Testosterone comes from between the tubes. Okay, blood and nerve supplies to the testes. The testicular arteries come directly off of the abdominal aorta because they are the gonadal arteries in a male, okay? And then they're drained by the testicular veins, which either go directly into the inferior vena cava, or on one side they'll go into a renal vein. The testes, of course, have autonomic motor innervation, parasympathetic and sympathetic, primarily to the smooth muscle and the glandular secretions that are going on in there. And then the testes have lots and lots of visceral sensory innervation that lets the male know when injury is a possibility. These things are under really high pressure and they can pop. So a male needs to know when injury could occur so that you can protect. I want to talk about sperm and then semen. So the seminiferous tubules are here. So let me tell you what goes on in the seminiferous tubules. It's kind of like what went on in the ovaries, in which basically around here, around the outside, all of these cells that you're seeing right there in the seminiferous tubule, and it's not explained very well in your notes because I don't usually test on it, but I want you to understand. In a male, all of these around the outside would be diploid with 46 chromosomes. And what would happen is as the cell starts to undergo meiosis and it goes toward the lumen of the tube, it starts to reduce the chromosome number, so from 46 to 23, and then it goes through meiosis 2, and then they get little tails. So from the outside to the inside of every single one of these tubes and every single lobule, you are going to be doing spermatogenesis. The difference between a male and a female is not only do you do meiosis or spermatogenesis to make sperm, you also are making more of these cells all the time. So they're doing mitosis with those cells to make more, and then they're doing meiosis to make sperm. So advanced paternal age is not as much of a problem as advanced maternal age. In addition, of course, during the reproductive process, there is going to be one, usually, egg that could be fertilized, but there will be millions, like 350 to 500 million sperm per ejaculate. So even if there was an abnormal sperm, it probably just wouldn't win the race. So for that reason, advanced age is more of a problem with maternity than paternity most of the time. Now, there are situations in which advanced paternal age can cause more likelihood of chromosomal abnormalities, but it's not as likely. The stats are just with the males on this. Okay, so if I am actually going to conduct sperm, which was made in the seminiferous tubules, it would go seminiferous tubules to rete testis to efferent ductules, and then it would go into this structure, and this structure is called the epididymis. And the epididymis contains a really folded tube too. It contains 4 to 5 meters of folded tube called the duct of the epididymis, and it's lined with ciliated cells. And what is happening, and by the way, the epididymis looks like this, the structure that's on the surface of the testis. What's happening inside the epididymis is that when sperm were made in here, they got their tails, but their tails weren't fully functional yet. And they also needed a little hat called an acrosome. That little hat is packed with enzymes that can burrow through the wall of an egg or an oocyte. And you get your functional tail and you get your hat as you're going through the epididymis from the head to the body to the tail, okay? And when you're at the tail of the epididymis, then you are a fully functional sperm that can swim and has your hat on. And this takes about 20 days. And so sperm are actually not ejaculated from the testes. They're actually ejaculated from the epididymis. And they're not fully functional when they're coming from the testes here. If there is any unejaculated sperm, and there will be, right, because there's millions and millions, they're just reabsorbed into the epididymis, recycled, all the parts. So if sperm gets ejaculated, though, it will be the first of the components of semen. And semen and sperm don't mean the same thing. Sperm is just the little wiggly guys, and semen is actually all of the fluids plus the little wiggly guys. If sperm is ejaculated, it will get ejaculated from the epididymis into the ductus or vas deferens. And then the ductus or vas deferens is going to run up through the scrotum, right? And then it is going to have this strange little circuitous route. So sperm would be made here, mature in the epididymis, run up through the ductus or vas deferens, through the inguinal canal, wrap around the backside of the urinary bladder, and then it's going to join with its friend, the ejaculatory duct. It's going to join with its friend, the seminal vesicle, and we'll look at that picture in just a second. Okay, so inguinal canal, spermatic cord, arches over the bladder anterior to posterior. And then the extended distal portion of the ductus or vas deferens is called the ampulla, which is just this wide portion. And then it joins with the duct of the seminal vesicle to form the ejaculatory duct. And we'll look at that in more detail here. Okay, here's a posterior view of the male reproductive tract. So you're looking at the back of the urinary bladder. Testis with seminiferous tubules in here, right? Then it's going to go in here for 20 days to mature. This is the epididymis. And then up and over, right? Up into the ampulla. Here's the ampulla of the ductus deferens or vas deferens. Here's the seminal vesicle. When the ductus deferens and the vas deferens meet, it's in the ejaculatory duct. And it's always hard to see what the ejaculatory duct is. Here's the ejaculatory duct, because this is the urethra. This joins with the urethra. The ejaculatory duct is really when the reproductive components will join into the urethra. Okay, and that's it right there, the ejaculatory duct. Okay, and then, all right. The ductus deferens or the vas deferens has a thick muscular layer that will contract upon ejaculation. One of the things that will happen upon ejaculation is pretty much everything from the distal end of the epididymis all the way up through the ductus deferens will contract. The seminal vesicles will secrete. The prostate gland will secrete. The bulbourethral gland will secrete. And the urethra will actually contract the smooth muscle. All of this to get the semen to the distal end for ejaculation. Okay, so clinical notes. Vasectomies. What are vasectomies? What the heck goes on with a vasectomy? So one of the things that a man or a couple could choose to do to control their to have reproductive control would be one of the most reliable forms of birth control is what we call a vasectomy. And with a vasectomy, what would happen, this is an outpatient surgery, you open up what's called the spermatic cord, and the spermatic cord has got the cremaster muscle running through it, it's got the vas deferens, the testicular artery and vein, and some nerves in there. Be careful what you grab, but open it up, there's connective tissue around it, open it up, and pull the ductus deferens out. And what you do is you cut the vas deferens or ductus deferens, hence vasectomy, and then you tie it or sear it or cauterize it or any combination of the three. What ends up happening then is that although sperm is produced and matured in the epididymis, it can't get into the urethra because it actually never makes it past this region right here. And so it's reabsorbed, actually. And this is a much less invasive procedure than the process of tubal ligation that occurs in a woman, which is kind of this permanent form of birth control. And I only say permanent because there are successful vasectomy reversals about 50% of the time. It's not the kind of thing you would want to do if you were planning to reverse it, but it is not impossible to reverse, whereas tubal ligations are really, really unlikely to reverse. Okay, so now let's talk about the urethra, the male urethra. So remember, we learned this in the urinary system. There's the prostatic urethra as it runs through the prostate. There is the membranous urethra as it runs through the skeletal muscle and is surrounded by the external urethral sphincter. And then there is the spongy or penile urethra. And then the external urethral orifice is at the tip of the penis, and it's a common orifice for both semen and urine, but generally not at the same time. Okay, one last little thing to just review the spermatic cord, which is right here. All of the vessels and tubes that run through the inguinal canal are considered in the spermatic cord. And there's blood vessels, the testicular artery and vein, nerves, the ductus deferens. And when something gets pushed through here that was supposed to be up here, it's called an inguinal hernia. Far more likely to happen in males than females because the process of the testes moving through the inguinal canal during fetal development means that the inguinal canal is usually a little wider in males. Okay, we'll stop there.